The government employees medical scheme says it's losing 22 billion rand a year to fraudulent claims as patients often collude with healthcare professionals. Back in 2019, the Council for Medical Schemes estimated that fraud, abuse or waste accounts for over 25 million of the 160 billion rand in claims paid by medical aids. So let's unpack this story for you now. We're joined by Dr. Stanley Moloabi, who is the Principal Officer at the Government Employees Medical Scheme, to get a sense of the extent of fraud in the sector. Dr. Moloabi, it's great to have you with us on the show this morning. And these numbers are staggering. And according to the information that we have in front of us, it's not just people who are claiming, but it's actually the medical practitioners themselves who are in many cases colluding to result in these big numbers.
Good morning, Michelle, and good morning to the viewers of Newzroom Afrika. And Michelle, can we just just correct? When you started with, you said the government employees is losing about 22 billion rand to fraud, waste and abuse. It's actually an estimate of the industry as a whole. So
right.
Of the industry, yes. Okay, I think that's important that we state. And it is definitely a staggering figure, and it is something of big concern to us at the GEMS and the industry as a whole.
Yeah. So break it down for us for the government employees medical scheme. If the industry is losing that much money to the tune of 22 billion rand, what's government employees medical scheme losing?
You know, it's very difficult to give you, and that 22 billion is an estimate on fraud, waste and abuse.
Right.
Now, we do a lot of work as well to prevent fraud, waste and abuse within our midst. And the figures, remember, we have to investigate, and there are various areas that, draw our attention to this problem. So there are those claims where there's been a whistleblowing, and I'm going about it the long way because the estimates are difficult because some claims end up being found to be valid when we do investigations and then we release them. When we see trends that are unusual in the claiming patterns of various healthcare providers, we would then block payment of such claims until they're investigated. So the figures can vary, but if you take that we at GEMS, and we're saying the industry loses anything between 5 and 15% of what they pay. So we pay in the region of just under 40 billion rand in claims annually. That is the figure that we pay in claims. So about 5% of that, if we take the lower end, would be about 2 billion rands. If we say about 10%, as it is estimated in the industry, then we'll be talking in the region of 4 billion rands.
Sure. Yeah, those numbers are staggering. I want to talk more about how it can be that the numbers are so incredibly high, because it's actually not easy to submit a fraudulent claim, is it? Because you've got to have all kinds of codes, you've got to have authorization from your medical aid scheme, etc.
Agreed, Michelle. All of those are the checks and balances that are there, and we do use them. So when we pay a claim, it has to be in accordance with the Medical Schemes Act. And there are a few criteria like the code, what was the service for, depending on what type of service is the doctor registered or the healthcare professional, because it's not only doctors, it is healthcare professionals. And so we do those checks. However, because of it's a third-party payer system, there is always an opportunity that claims could be submitted when services, as an example, services have not been rendered. So you suddenly get because we send a message to our members when a claim comes through. And often we find members phoning our fraud line and say, I did not consult with that healthcare professional. So it is an example. The opportunity is created by the fact that it is a third-party payer system.
Right. So on the last point that you've just mentioned, this is why it's also important as a member of a medical aid scheme to keep track of what's leaving your medical aid account, so to speak. Let's say if it's your medical aid's savings account. insofar as healthcare professionals themselves lodging claims where no service has been rendered, it's up to me then, as the person whose name the medical aid is under, for me to keep track of that and to get in touch with my medical aid scheme if I do see something untoward.
Absolutely true. And I think that is one of the weaknesses in the system, where you see that members, because it's not like you are paying money out of your pocket, where you would check exactly what you pay for. Because it's an insurance type of a payment, then the tendency would be that you would basically not check whether it is for the services that you have actually received. But we must also admit that, it is not a simple, these invoices are not written in a simple way. The codes, people don't understand, our members may not understand the codes, the language that may be used on these claims. Even if you check it, it may not make sense to you. And you check it, it's not simple language. And that is one of the things that also came out of the health market inquiry, that buying health as a product, it is not a simple product that people understand very easy. And that also creates this opportunity that you are talking about. But I must also state that it is a very small percentage of healthcare providers who are actually involved in fraud, waste, and abuse. And that is one of the challenges. We shouldn't paint the entire healthcare industry with one brush. It is a very small percentage, but that small percentage has a huge impact on the benefits of members.
Yeah, absolutely. And where it is found that healthcare providers are colluding in this way, be it inflating claims on behalf of their members, be it submitting claims where services have not been provided, is it quite easy? It sounds on the face of it that it is quite easy to get to the bottom of that and to hold that healthcare professional accountable?
Well, it is the challenge that we have faced. If you remember, at the beginning of the year, there was the release of the Section 59 interim report. And these are the issues that the investigation was looking into, because there was a complaint that healthcare providers are not being treated fairly. In fact, the allegation was that there is bias against the black healthcare professionals. Now, that just indicates how complex it is. So there are processes that we follow to investigate where there are indications that fraud, waste, or abuse may have been committed. But it is not an easy thing. We have processes in place. We have actually done a lot of work since the interim report to also improve where we thought that there are indications that maybe we should do it a bit differently to be sensitive to the complaints that came out. So it is, in essence, what I'm saying is it is a very complex thing, but we have a responsibility to preserve the funds of our members.
And very quickly, Dr. Moloabi, what are the sanctions that are available if it is found that a healthcare professional is involved?
So the first thing, in terms of the Act, we do what you call indirect payment, which is also a matter of consternation for the healthcare providers. What that simply means is, if there's no problems with your claims, you submit a claim, we pay you directly. But if there's some evidence of abuse or fraud, or which we are investigating, when a member consults with a healthcare provider where there is suspicion and we are still investigation, we'll then do what you call a direct payment. We don't pay the doctor directly. We'll pay you for the consultation in terms of our tariffs, and you would then settle your account with the doctor. That was also an issue in terms of interpretation of the Section 59, that section of the Act, which is Section 59.
Yeah. Dr. Stanley Moloabi, thanks very much indeed for talking to us this morning, giving us some great clarity there on what is taking place in the healthcare sector. Private healthcare losing more than 22 billion rand a year to fraud, waste and abuse. Some good advice there. If you are a member of a medical aid scheme, it's a good idea to keep a check on the statement that you receive, no doubt, every month. He is with the Government Employees Medical Aid Scheme, giving us some insight into that issue this morning.